Hello, everyone. I'm Jim Paymar, and you are listening to The Big Shift, the podcast that looks at the seismic changes our world, our economies, and our environments are confronting. Today, we're discussing the critical issue of healthcare. It impacts every man, woman, and child in America at some point in their lives. Of course, as we all know, healthcare can be very expensive. An average 3-day hospital stay could cost up to $30,000. Healthcare spending accounts for nearly 20% of America's gross domestic product. And medical care is becoming more sophisticated and more complex every day. Joining me to discuss this very important issue is one of the world's foremost authorities on the subject, Michael Dowling, the president and CEO of Northwell Health, the largest healthcare provider in the entire state of New York. Michael, welcome to The Big Shift, and glad you could find the time to talk with us.
Thank you very much, Jim. I am delighted to be with you. Appreciate it very much.
Michael, when I did my first interview with you on a PBS TV station serving New York, there really was no Northwell. The network was called North Shore Long Island Jewish Health System. There was one hospital. Today, you are a Goliath with 21 hospitals, 890 outpatient facilities, and 220 primary care practices. You became CEO about 20 years ago. Tell me about the spectacular growth of Northwell and what was the motivation to create this giant system?
Well, the system has grown pretty much every year for the past 25 years or so. And it started out by just bringing hospitals together. But healthcare has changed and evolved. And as you just mentioned, today we not only have hospitals, but we have ambulatory and home care and medical school, nursing schools, etc. And the whole idea behind it all was to be able to provide care in a much more holistic way to the community and enhance the access to care and make sure that we protected those hospitals that if we had not merged with them, would in all likelihood have closed. So I think we're in a much better situation today in terms of care delivery than we were before. So, and that became unbelievably evident during COVID. The benefits of a large health system was so evident as it was because of the way we were able to address the COVID circumstance. If we did not have a large system during COVID, we would have been in dire, difficult circumstance indeed.
Michael, Northwell is now the largest private employer in all of New York State, and we're over 20 million people. And you've got a workforce of 83,000. You have, this is hard to believe, 5.5 million patient encounters a year.
Right.
And you have annual revenues of $16.5 billion. I mean, that is one massive organization. It's mind-boggling. How do you manage this giant? And is bigger better?
Well, on your first question, you can easily manage something this large if you do a couple of things. One, you stay focused on what your core mission is. And secondly, that you bring on board and hire the smartest people you can possibly find.
Mm-hmm.
Not the people necessarily with the highest grades in college, but the people who have the right motivation and are able to inspire others to do good work. So I spend a lot of time on the human element of care of the organization. Who do we hire? Who do we promote? Who do we put in responsible positions? When you do that, and you don't have to worry about having the wrong people, and you work as a team, then it is not as difficult as people think. But you've got to focus on it each and every day.
I've heard you talk about the word team over and over and over again. You were an athlete and you really believe in teamwork. How important is that in running an organization?
It is essential. It is the core element in my view. Nothing can work if you have people who do not collaborate, who do not share expertise, who do not respect one another, who do not take input from different people with different viewpoints. You want people that at the end of the day are rowing all in the same direction. You set yourself a goal and everybody's moving toward that goal, just like any sports team would do if they want to win. And you have to have utility players, you have to have your stars. The team also means you have your doctors working with your nurses working with the administrators. It's avoiding silos and it's building trust. Team built trust. Without trust, you don't have success.
You know, Northwell Health is a privately owned corporation, and you have operating revenue, as I mentioned, of over $16.5 billion. Is that revenue derived from insurance companies and costs collected from patients, or are there other sources of revenue? And then beyond that, how do you finance the incredible growth we've seen over the last decade at Northwell?
Well, the revenue, there are three major sources of revenue. One is a commercial revenue from negotiations with private payers. So somebody gets insurance through United Health or Aetna. We negotiate with those insurance companies for them to pay us when we take care of their members. That's a portion of our revenue. Next biggest portion of our revenue is Medicare. This is the governmental program for people primarily over age 65. And some of Medicare is contracted out to the insurance companies to manage. And then we get the payment through them from Medicare. And then the third element is Medicaid. Medicaid is the state program, partly financed by the federal government, but it's the state program that takes care of lower income individuals. So
I see.
what I have to worry about is I have to make sure I have the proper balance between those three sources of income, because the commercial payers pay us more than Medicaid. Medicaid, for every patient you see in Medicaid, every Medicaid patient, you lose money. Medicare, you lose a little bit of money, but you do okay. So I have to negotiate good rates from the commercial payers to be able to subsidize the low rates that come from government.
But where is the money coming from when you buy another hospital, or you merge with another hospital, or you buy up doctor practices?
That money comes from the margins that I try to make. I try to make a margin in the every year. And the margins are very small. Our margin on a $16.5 billion revenue is around 1.5%. So every year I try to be as efficient as I possibly can. The margin, all the money from the margin is plowed back into the organization and is plowed back in the following ways. The margin is used to recruit the best employees you possibly can and pay them as well as you possibly can. It is used to invest in bringing doctors and researchers in. It is used to invest in new discovery and education. It's used to invest in infrastructure and technology growth. And we use the money to invest in expansion. If I want to bring in an extra practice, if I want to open up another facility, that money is used for that. Along with, we take on debt. We borrow. Go to the bond market. We raise money. And then we do some fundraising. So we obviously like to be able to, for people who we know who want to commit some of their resources to the well-being of the community, it's called philanthropy. So we get
right.
Small portion, but it's important.
Gotcha. What's the biggest challenge that you face today in running Northwell? I mean, costs keep rising. Insurance keeps getting more expensive since the pandemic. The workforce has become more fractured. But I believe somehow you managed to recruit, and this is a hard number to believe, 350 new employees every week. How is that possible?
Well, and I meet every single one of them, as you probably know, Jim.
I know you're a hands-on guy.
Yeah. The biggest issues, in my view, I don't ever look at things as problems or major challenges. I look at everything as an opportunity. So leadership at its essence, is about being optimistic and positive.
Mm-hmm.
So, obviously you've got challenges, you've got issues with regard to bringing in enough nurses on an ongoing basis, making sure you hire the right staff, finding enough capital to invest in all of those things you would like to invest in, because it's like everything else. It's like a local family's budget.
Mm-hmm.
You have a lot of things you'd like to do, but you have a limited budget. So you make choices. You would like to do X, but you can only do X minus. You would like to do 3 new facilities, but you can only do 1. You would like to do them this year, but you can't, so you wait until next year. So it's all a matter of making those choices. And we have been pretty fortunate that we have been able to continue to grow, expand, enhance the delivery of care, improve access all of these years. And that's what we will continue to do. It's never completely easy, but it never should be easy. That's why we're in the positions that we're in.
When you hire staff, Michael, and you touched on this, you're obviously looking for the most qualified, effective, and enterprising people that you can find out there. What particular traits are important when you bring someone onto the Northwell staff, especially those who run the hospitals and other facilities, the medical professionals? You've talked in the past about resilience, enterprise, attitude. What's the bottom line for you?
The bottom for it being generic in my answer to begin with. One is I am very interested in positive attitude. I could care less whether you got 4.0 in your grade in college. That's not that important to me. It's all about what your motivation is, how interesting you are to do good, how optimistic you are about the possibilities that you have, your willingness to be adaptable and flexible, your
Mm-hmm.
willingness to be resilient. You want bright people with positive attitude,
Mm-hmm. Mm-hmm.
who are
And
willing to take on responsibility and deal with tough issues when the tough issues arise. So I look for attitude, attitude, attitude.
positive, positive, positive,
Yeah.
right? Just moving forward. I'd like to switch gears now to the Affordable Care Act for a
Right.
second, ACA, Obamacare. It seemed in past years the Republicans were saying almost every day they were going to dismantle ACA and replace it. And I was never really clear on exactly what they were going to replace it with. They seem to have gone silent on that issue. And I don't want to go political here, but where does ACA stand today? And in your view, has it been effective? Can it be improved? There are still 30 million Americans without any health care insurance.
Well, everything can always be improved. You never get anything completely right. Obamacare has been quite successful. There are tens of millions of people today who have more easier access than they had prior. The Republicans, as you mentioned, they criticized it because it was an Obama piece of legislation,
Mm-hmm.
but they never were able to come up with an alternative. So they're
Right.
quiet about it because they don't have any positive, productive alternative. So when you have no alternative, you can't keep complaining all the time. You just shut up about it.
Just
So
a lot of rhetoric.
a lot of rhetoric. I mean, I don't think there is anybody, including the strongest proponents of Obamacare, who would not like to get suggestions that are productive and would enhance the program.
Mm-hmm.
Everybody who's rational will listen to those ideas. But when there are no positive ideas coming from the other side, it gets very, very, very frustrating. So Obamacare, to me, has been a very positive thing. We've obviously got to continue. We have to get to a point where every single person in the United States has insurance coverage, and universal coverage, which is, typical in most other countries, but not here. That does not mean that people don't get at some point access to care, because in our health system, irrespective of whether you have insurance or not, if you come to our facilities, whether it's an inpatient or an outpatient facility, whether you have resources or not, it doesn't matter. We take care of you.
You'll get treatment.
We
You'll
never
get
turn
treatment.
anybody away. Absolutely.
Yeah.
be, you may not be, always completely ideal in terms of location, etc. But you will get care. So
Mm-hmm.
nobody will go without care eventually. But it's better if everybody has insurance, and that is the goal. That's why a lot of states have expanded Medicaid, like New York. Other states, however, have gone in the opposite direction and diminished Medicaid coverage, which I think is problematic and disastrous for many people. But that has to be a continuous goal. It shouldn't be just a political football that we play around with.
Mm-hmm.
It would be easy to set a goal and say we all want to move in the same direction to get universal coverage for everybody. But I want to make one point. It's one thing to have universal coverage. You've also then got to make sure that everybody has access to care.
Mm-hmm. Mm-hmm.
And many people will mention other countries, and I will take Ireland for example, where I'm from. Everybody has insurance coverage, but getting the access to care is becoming very difficult. So it's a combination of having coverage and then being able to have access, and so they're not exactly the same.
Well, speaking of that, Michael, America does not have universal health care. And I was reading up today, and that 43 countries in the world offer free or universal health care to at least 90% of their citizens.
Right.
And of course, the standards are different in each country. And you mentioned Ireland, and you also mentioned Ireland in terms of patient access to hospitals and medical facilities in one of your speeches. But why doesn't America have universal health care? And because we don't, are American citizens suffering more health problems than those countries that do provide health care to their people?
Well, that's a complicated issue. I mean, people's health and their ill health is not necessarily the result of the official healthcare system that we typically talk about.
Mm-hmm.
People's health is due to lifestyle, behavior, how we eat, whether or not we exercise. In the United States, one of the highest incidence of mortalities, right, for example, these days, especially the leading cause of death among children is gun violence. The healthcare organization, I and my hospitals, we don't cause that problem. We respond to it. So if people don't, if people's behaviors do things that add to their ill health, you can't blame the health system for that. You blame individual behavior for that. So we've got to be a little bit careful. We have more deaths from guns here than any place else. You don't have the same availability of guns in most other countries that you have here.
Well, I know one issue of particular importance to you is gun violence. It's the number one cause of death among young people today. Beyond that, there have been 33 mass shootings this month of January 2023, 648 mass shootings in 2022. More than 44,000 people died due to gun violence in 2022. You've been waging a battle to put an end to this scourge. Tell me about your efforts.
Well, we went public a couple of years ago, Jim, to try to get other healthcare organizations across the country to engage in this as a major public health issue. When people get shot, we obviously deal with the physical injuries, but then you have the trauma that's associated with it, the mental health issues, the family issues, the community issues. It's an absolute disgrace that the United States has a distinctive characteristic in this area. We should not be known for this. So healthcare has a responsibility. We have to deal with it to figure out how to promote safety and prevent it as much as possible. Now, that won't happen completely until Congress acts on the availability of guns. I, for example, cannot understand at all why people can go buy an assault rifle or an assault weapon, which makes no logical sense to anybody, even I believe for those who support the Second Amendment. And I'm not challenging the Second Amendment, but I do think healthcare has a real obligation here. And I now have almost 50 CEOs of the big health systems across the country, all coming together as part of a CEO council on gun violence prevention and safety. And it's all about enhancing awareness. We have an ad going on TV right now that suggests that if you have a gun in the home, we ask the question, is it locked up? We all remember this case a couple of weeks ago of a 6-year-old in Virginia who walks into the school, shoots his teacher.
I know.
He got that gun sitting around at home. So we are doing everything we possibly can to improve and change people's attitudes about this. And I think we're making some progress.
And every time there's a mass shooting, people go out and buy more guns.
Well, we've got so used to mass shootings now, people don't get that agonized about it as much anymore. It's like, oh, yeah, another one. We expect it.
It's ridiculous. One thing, Michael, that struck me when you spoke to the folks at the University of Galway in your home country of Ireland, you have a security detail because of threats made against you, much like we heard about Dr. Anthony Fauci, who served many presidents in the healthcare arena. And he was made into a villain by many on the extreme right after the pandemic broke out. And there was so much controversy about whether or not you should get vaccinated or not. How do we as a country deal with this kind of threatening environment? You shouldn't have to have a security detail around you.
Well, that is true. I mean, we have lost the ability to compromise. We have lost the ability to be civil in our public discourse. We have lost the ability to respect other people. We are driven by people on the far right and people on the far left, and our politics responds to those extremes. Unfortunately, we see that happening in the deliberations in Congress over the past couple of weeks. The public deserves better from the leadership here. And I think those of us who have some influence in our respective arenas have to continue to speak up, talk about the importance of democracy. And democracy is based upon civil respect and trust and respect for science. Democracy is built upon not accepting misinformation and conspiracy theories all the time. Right. So the big, strong middle and all the leadership who are in the middle have to start voicing their opinions an awful lot more so we can modify the left and the right.
I've interviewed scores of CEOs during my time as a financial correspondent at CNBC, from Bank of America to Dell to Home Depot. You are not a typical CEO. You grew up literally dirt poor. If memory serves me right, you told me on one of our TV interviews that the home where you were raised in Ireland had a dirt floor.
Right.
You've been on your own since you were very young. I think it was 16 years old. You worked in construction. You were a plumber. How did you get to where you are today? What drove you to achieve?
Well, I did grow up in that environment, but poverty is a wonderful motivator. It strengthens you. If you look at it the right way, it builds resilience. It builds grit. I was very fortunate to have a wonderful mother who encouraged education, who encouraged learning, who basically continually implied that your circumstance and where you exist today is no predictor of where you can be in the future. So I, from a very young age, wanted to get out. You look out over the horizon and you see possibilities. You don't sit and exult over the problems you're in. You look at the possibilities that exists out there, and we should be teaching all of our kids this. Build resilience. Everything is about possibilities. And I was very lucky. I've had lots of great people in all the various roles I've had that offered encouragement, that offered advice, that gives you an impetus to keep moving forward. So it's not a journey you take alone. You do it because of the input by all of those others around you, because we're the result of the constellation of influences of everybody that comes in contact with us.
I'm gonna quote from you right now. And perhaps this is part of the soul of Northwell, and it relates to your upbringing in Ireland and how you achieved what you have achieved. You said, when I'm out there and I see people suffering because of lack of housing, healthcare, or food, I feel I can understand it better than most because I experienced it. I was there. I have an understanding. That's what the world is like. I've seen the underbelly of society and the elite side of society. It gives me, I think, a more robust view of the world from many different angles. Tell me how this helped you in the development of Northwell.
Oh, I think it has helped greatly. And this is why at Northwell we are unbelievably committed to working in the communities all around us here to do everything we possibly can to improve, to give advantage to people who may not have it, to deal with the most difficult issues. Right now, for example, we're very involved in providing scholarship support, apprenticeship support, and mentoring support, for example, for hundreds and hundreds of kids in difficult environments, so that if they go to college, I will provide some financial support with their tuition.
Mm-hmm, mm-hmm.
Because when even if you take a child out of a family that never had anybody go to college and you give them the opportunity to go to college, you not only change that individual, but you change the family. The family is better off afterwards. The family thinks differently. The siblings think differently. I was in that situation. I remember it. And therefore, in the role I have here at Northwell and all of the other great people that work with me, we believe that. That's
Yeah.
why we're here, to improve the overall health of the community, which goes way beyond just the delivery of medical care.
It gave you empathy, and you are relating that to the people that you work with. I'm curious about where you see the healthcare industry going in the future. Is the Northwell model the vision of the future? Massive healthcare systems that offer every kind of medical service available, from hospitals to doctors' offices to urgent care, telemedicine, and home care?
Yeah, I think that is the evolving model. I think that that's the right way to go. I think it is built off models like this have existed before, like Kaiser Permanente in the West Coast. I do believe that providing healthcare is a continuum. It's primary care and ambulatory and inpatient and nursing home care, etc. And we've got to be in all of those facets. So I do think that large health systems like Northwell will continue to grow. Now, you have to grow for the right reason. You have to expand for the right reason. The central mission has to be to improve the overall health of the community. That has to be the central goal. You have to run it like a business as well, so that you can, you're not losing money all the time, because if you do that, you're not going to be able to provide the care that you want to provide. I think, and we benefit from the advantages of and the advances of science. Just think of where we are today relative to where we were 40 years ago. We're living longer. We're curing disease. We're curing people with cancer. We're
Mm-hmm.
saving people who've got heart disease. We were not able to do that 50 years ago. We're doing it today. The result, of course, is that we're allowing people to age longer. So one of
Mm-hmm.
the biggest problems that healthcare and societies and governments are going to face in the future is the growth of the aging population.
Right,
Uh,
right.
But
Listen,
that's a
I know you
positive
have
thing.
to
Yeah.
I know you have to run in a few minutes. I just have a couple more questions I want to ask you. I see what's going on in the New York area, and I've lived in California, I've lived in Washington, I've lived in Minnesota. Is the creation of these healthcare conglomerates like Northwell, like Mount Sinai, NYU, Langone here in New York, is this limiting competition? Are we just going to see a few giants in every region of the country?
The competition is extraordinary here in New York. Even though there's a number of us that are very large, the competition is heightened because of.
Mm-hmm.
Plus, you have competition from other players:
Mm-hmm. Mm-hmm.
CVS, Walgreens, technology companies, insurance companies that own physician practices all over the place. There is more competition today than ever before.
Uh-huh.
I think the community is benefiting because of this. I had mentioned earlier that there are 5 or 6 hospitals that if I hadn't taken them over and improved them and fixed them, they would in all likelihood have closed, which means those communities where they existed would have a lack of access to care. So we have enhanced access. We do more in the community. Most of the ambulatory care that is there, that out the hundreds and hundreds of locations all over the place, those are the results of investments by hospitals. They wouldn't have existed otherwise. So you have to make sure you do it right. You have to make sure your mission is positive and community focused. You don't grow and get big just only for financial purposes. You grow to improve the health of the community. And I think that because of what has been happening, I think we're better off than we were before.
Well, are there going to be private medical practices in the future, or will most doctors join these big groups like yours? I can speak from experience. Most of my doctors are now with Northwell when they were private just 5-10 years ago.
Yeah, the old traditional private doctor who sets up his shingle in front of his home with a secretary, that day, I think, is mostly gone. That doesn't mean that he's in private practice.
Right.
You have practices inside our facility. They operate, you have a doctor, a group of doctors working together, and we try to retain the DNA of a private practice, but they're able to survive now. Whereas if they were out completely on their own, they wouldn't have been able to survive. That have had
right. Well, listen, you've been CEO of Northwell now for over 20 years. When you decide to pack it in one day, what would you like to be said about what you've created? And how would you like the system to proceed over the next, let's say, decade or two?
Well, I think we have a good foundation here. And I would very much like to see whoever comes next, the whole team that comes next, that they build upon that foundation. And my hope is that we be as good at preventing illness as we are at treating it. That means the wellness issue. I mean, we do very, very good work in taking care of you after you get sick. We have to do a lot more to help you help yourself so you don't get sick. This is the prevention wellness side of the equation.
Right.
We got to do the downstream well and the upstream well. And I would, you asked the question, what would I want people to say? I'd like people to say he tried. He did his best. And he, that we never completely succeed. We spend our lives chasing success.
Right.
And you never get there because the goalposts keep moving all the
time. That's true, Michael.
So we live in a constant state of frustration because you're never going to get to where you want to get to.
Yeah. Michael, I could talk to you all day about these issues, but we are out of time, and you have a huge medical organization to run. I want to thank you so much for sharing your thoughts and your insights.
I thank you, Jim. And anytime, it's a pleasure. Anytime you want to do this, I'd be more than delighted because I invite you as well. Thank you.
That was Michael Dowling, the CEO of Northwell Health, who, by the way, was named America's most influential healthcare leader in 2022. And after listening to this interview to him, you can easily see why. I'm Jim Paymar, and you have been listening to The Big Shift, available wherever you get your podcasts. Thanks for listening today, and stay tuned for the next episode of The Big Shift, coming soon. Stay tuned.